Hello everybody, thank you for taking the time to watch this video. The following presentation has been produced by Line Health, formerly known as Worcester Street Surgery. This video is designed to run alongside our online blood pressure management service known as InControl. Hello there, this is Dr. John Woolley and I'm one of the partners here at Line Health. This is the first in 3 videos designed to help you look more closely at how to check your blood pressure, when to check it, and what the results actually mean. There's absolutely no point in us checking blood pressure unless we can do so with accuracy and consistency. The first thing is to ensure that your machine is likely to be accurate, and to do this we'd recommend a machine that checks blood pressure via a cuff that fits around your arm. Wrist monitors are not recommended. To check that your machine has been validated for use at home, we recommend following the links on our website, which explain this in a little bit more detail. Before checking your blood pressure, it's important that you've read the instructions that come with your machine. The machine will consist of the box, which has the buttons on it, and the cuff, which wraps around your arm. In order for your blood pressure to be measured accurately, the cuff must be the right size for your arm. The bit we are most interested in is known as the bladder, and this is the bit which actually inflates. And it is shown here in this close-up image. When placed around your arm, this part of the blood pressure cuff should fit about 2/3 of the way around your arm. And depending upon your arm size, there are different cuff sizes that you can get. This size, however, would be too big for this individual. More information on sizing can be found on our website. Before you check your blood pressure, it's important to be relaxed, and we'd suggest sitting quietly for at least 5 minutes before you intend to have your blood pressure checked. We'd like you to avoid drinking caffeine or alcohol, and make sure that you've emptied your bladder and are not unduly stressed at the time of when this blood pressure is taken. Also try not to talk if at all possible, as this can also increase your blood pressure. Having rested properly for 5 minutes, you should now be in a position to check your blood pressure. It's important that you don't cross your legs and your feet should be flat to the floor. It's also important that your back is supported and your arm resting at roughly the height of your heart. When you're ready to fix the cuff, make sure that you have it the right way round. This means that the arrow and the pipe will be on the front and the arrow will be facing downwards. After you've placed the cuff around your arm and fixed it tight, move it around so that the arrow and the pipe are facing downwards and are roughly in the centre of your elbow. The bottom of the cuff should be about 2 fingers breadths above that crease, and although fitted tight, you should still be able to place a finger between the cuff and your skin. You're now ready to press the start button and check your blood pressure, so sit back and relax. After the cuff has stopped deflating, you should write down your readings. It's very important that each time you check your blood pressure, you do so on at least 3 occasions, with at least a 1-minute gap in between. When you've checked your blood pressure, your monitor will often give you 3 readings. The first is your systolic blood pressure, and this is often found at the top and is often the highest reading. This blood pressure reading equates to the pressure in your heart when it pumps. The next reading is your diastolic blood pressure, and this is always less than the one above it. This particular reading equates to the pressure in your heart when it's completely relaxed. The other reading that you'll often see when you look at a blood pressure monitor is the pulse rate. We don't often worry about this, and certainly unless this reading is less than 60 or greater than 100, then it's often of little significance. As mentioned earlier, each reading must be taken at least 1 minute apart, and we would request that you check it 3 times. And that concludes our first video explaining how best to check your blood pressure. Thank you for taking the time to watch this video.